Knee osteoarthritis is very common in our population. As we get older, many patients suffer from knee pain. It can be totally debilitating or just merely an annoyance. Treatment options vary from physical therapy, medical therapy, joint injections, all the way to joint replacement surgery. A new approach to treating patients with osteoarthritis is genicular artery embolization. Genicular artery embolization is a procedure where we insert tiny catheters into the arteries supplying the cartilage of the knee joints. Cartilage breaks down in patients that have arthritis over time, leading to bone-on-bone friction, which causes pain. Over time, our understanding of how arthritis progresses has evolved. There's a mechanical component to patients' pain as well as an inflammatory component to patients' pain. Genicular artery embolization aims to treat the inflammatory component of patients' pain. We do this by reducing the blood supply to the synovial lining of the joint space. This decreases the inflammatory process and leads to symptom improvement. Patients that have the genicular artery embolization procedure can still have other treatments on their knees should they be necessary. This does not preclude having joint replacement surgery at a point in the future.